And now I'm just going to close the curtain. Hi, my name is Natalie. I'll be your student nurse today. Could you just tell me your name and your date of birth?
I'm Kendall Wolfe, and my date of birth is February 13th, 2003.
Perfect, that matches your wristband. Can you tell me where you are today?
I'm in the hospital.
Great, and what are you here for?
I have some pain in my arm.
Oh no, we'll go ahead and get a handle on that. But for now, are you okay if I perform a head-to-toe assessment?
Yes.
Okay, perfect. Just to check your level of consciousness, could you tell me what year it is?
2022.
Great, so your level of consciousness is ×4. And then for that pain in your arm, can you tell me on a scale of 1 to 10, a 1 being like no pain at all, 10 being absolutely excruciating, how much pain are you in right now?
A 4.
4. Okay, what level of pain can you take before needing medication?
A 7.
7. So you're doing okay right now?
Yes.
Great. How long have you been experiencing that pain?
12 days.
12 days. Oh wow, it's been a while. How would you describe that pain right now?
It's aching.
Aching. Okay. And then does it radiate to any other part of your body or just stay primarily there?
It mainly just stays right here by my elbow.
Okay. And then could you tell me what usually makes the pain worse?
I like to lift some weights, and so that hurts, and doing push-ups hurts.
So you're very active.
Yeah.
And then what usually makes the pain go away or feel better?
Just laying my arm here like this and not moving it.
Yeah, rest. Perfect. Well, we'll go ahead and get you to rest. And then just for now, for this head-to-toe assessment, I'm just going to start with your head for obvious reasons. I'm just checking right now to see if there's any lesions, sores, there's bruising, scarring, which I don't see at all in both your scalp and your face. Your ears and your face are symmetrical, and so are your eyes. So I'm actually just going to check that the size right now looks approximately about like a 6 millimeter, which is absolutely normal because it's a little darker. There isn't light in your face, but I'm actually just going to shine a light right now to check how well they react. So just go ahead and look at my nose. I'm just going to shine this light in your face. Perfect. Now the other side. Great. So both are individually reacting to light, and they become about like a 3 or 4 millimeter gauge. Which is absolutely normal because they're just constricting with light. So now I'm just going to go ahead and move on to checking your carotid pulse one at a time. Great. And now moving on to the other side. Perfect. So I'm feeling about like a 2+, which is absolutely normal. And then now I'm just going to move on to just assessing the rest of your skin to also make sure there isn't anything wrong. Bruising, scars, lesions. I don't see any of that though. Your skin temperature is very warm, very normal. Your skin coloration is pink. I don't see any blueness, which would indicate that you're having low body perfusion. Now moving on to your hands. I'm just going to check your capillary refill bilaterally. So I'm just going to squeeze your fingernails. And it's taking about less than 3 seconds to return back to normal, which is perfect. That's exactly what we want. Great. And then your fingernails look healthy. I don't see any signs of infection. Now I'm just going to assess your radial pulses bilaterally. Perfect. Those are also 2+, which is normal. And then while we're at it, can you squeeze both my fingers as hard as you can just so I could assess this grip strength?
Yes.
Great. Perfect. I could tell you were getting very strong.
Thank you.
All right. Now I'm just going to go ahead and move on to assessing your lung sounds. So I'm going to start in the front just 6 times, and then I'm going to move on to the back, so I'll help you sit up for that. And right now I could just tell you're breathing at a normal rate. Your rhythm of rise and fall looks normal, but I'm just going to check with sounds. So every time I touch the stethoscope to your body, just breathe in through your nose, out through your mouth. Great. Again. Great. And then while we're at it, before I have you sit up, I'm also just going to assess your heart right now, and I'm just going to do that by auscultating the sounds. So I'm going to do 5 different spots, and I'll explain them as I go. So I'm going to start with the aortic area, which is the second intercostal space on the right side. Now moving on over to the left side, second intercostal space is the pulmonic area. A little bit lower is this area called Erb's Point. That is about the third or fourth intercostal space. Now the fourth intercostal space is the tricuspid area. Great, and now the fifth interclavicular line is the mitral area. And that's about like the fifth intercostal space. So the rate and the rhythm of your heart sounds normal. And now I'm gonna go help you sit up so I can assess the posterior or backside for your lung sounds. So I'm gonna do that in 9 different spots, and it's the same thing. Just breathe in through your nose, out through your mouth as I do so. You're doing great. Are you feeling dizzy at all? Perfect. Just a little bit more. Great, that all sounded perfect. And then while you're sitting up, I'm just gonna go ahead and help you sit over at the edge of the bed. Okay. Thank you. You could just stay like that. I'm just gonna go ahead and assess your legs and your feet to see if I also see any issues or lacerations. So everything looks great. Looks well. Your skin temperature is warm. Your skin coloration is also very pink, which would be normal. Now I'm just gonna assess the dorsal pedis pulses bilaterally. Those are about a +2. That's great. And now I'm assessing the posterior tibialis pulses bilaterally. Perfect. Now I'm just gonna palpate your ankles and your legs to make sure I just don't see any signs of edema or swelling, which I don't. This is great. Now I'm just gonna squeeze your toes just to do a little capillary refill to make sure you're getting perfusion to your feet, which is less than 3 seconds. That's perfect. Your toenails look great. I don't see any signs of infection. And then could I just see your hands very quickly so that way I could assess skin trigger or elasticity? Perfect. And then while we're at it, why don't you go ahead and push against my hands as though you're driving a car, you're pushing down the car pedals. Perfect. And then go ahead and resist my hands as you pull your feet to your head. Awesome, that's great. Now I'm just gonna go ahead and help you stand up, and we're just gonna do a walking assessment or ambulation and gait assessment. Okay, so I'm gonna walk you over here. Perfect. And now just go ahead and walk normally with me towards the end of that bed corner right there. Perfect. All right, and now as we walk back, just go ahead and walk on your heels, kind of like this. Perfect. You're doing great. And now for the last part, kind of like you're doing a drunk driving test. Just do one foot in front of the other. I'll stay right here. Perfect, you're doing great. Awesome, you did very well. I'm just gonna go ahead and move back to the bed. And while you were walking, I also assessed your back for any signs of lesions or swelling. So all around your skin looks great and I don't see any concerns. Now go ahead and lay back down just as you did. Now I'm just gonna go and then lower the bed so that way I can perform a abdomen assessment. So I'm just gonna go ahead and lift this up just so I can inspect. And your abdomen looks great. I don't see any issues of concern for your skin. Your temperature, your coloration is very normal. It is not concaving or protruding, it's very flat, which is healthy, that's good. Now I'm gonna go ahead and auscultate or listen to your abdomen sounds. And I'm gonna start in the right upper quadrant. Now the left upper. Now the left lower. Now the right lower. Perfect. Your abdomen sounds sounded great. I didn't hear any signs of hypoactivity or hyperactivity. meaning it wasn't too fast or too slow. It was all just under 5 minutes, which is great. Now I'm just gonna go ahead and lift this back up, and I'm gonna go ahead and palpate your abdomen. I'm gonna start with light compressions and then move to deep compressions. Could you just let me know if you feel any pain or discomfort while I do so? So I'm starting in the right upper, the left upper, left lower, and right lower. How did that feel? Did you feel any pain or discomfort?
No.
Great. Now I'm just going to go a little bit deeper. So right upper, left upper, left lower, right lower. Still feeling okay?
Yes.
Perfect. Alrighty, and I believe that completes just the head to toe assessment. Thank you so much for your cooperation. Your call light is right here, so just go ahead and push that button and I'll come running over. And do you need anything while I'm here?
No, I'm okay, thank you.
Okay, perfect. So I'm just gonna go ahead and sanitize one more time. And then I'm just gonna go ahead and close this curtain again for your patient privacy. And my name was Natalie once again, and I will see you later. Bye.